Hey everyone, so I just wanted to make this video regarding tips that I've learned from others about relationships, and these can hopefully apply to significant others, friends in general, and then maybe patient interaction and just people in general. So the first one is to pick your battles. There are certain things that are worth fighting for instantaneously, and then there are other things that you just have to let go. I think that I have seen people who will just fight about every little thing, and I'm not gonna lie, that's also me too at some points, and it gets exhausting on your end, on the other person's end, and just doesn't lead to a healthy relationship. So I think you just have to acknowledge that, there are certain things that you just need to let go. And kind of going along with that is you need to accept that people have flaws. Everyone has some flaw. And there are going to be things about someone that annoy the heck out of you. And they're going to be, you have to realize if it's something like, if it's someone you like and they have a little flaw, then you accept it. Because I think that there's also this problem that we have, at least that I have, is that I sometimes will just get so fixated on the negative things of a person that I forget the overwhelming amount of positives. And I've seen other people do it too, where, one bad thing happens and you get so fixated on that rather than just remembering, well, this person has done so much for me, so many good things, but I get focused on the bad. So I think it's important to realize that a person will have flaws, people will annoy you, but you have to remember all the good that goes along with those flaws, that make those flaws worth it. Going along with that as well is that you have to remember that you're flawed. I have flaws. I can be stubborn. I can be wrong. I think that it's important for me to realize the flaws that I have, so one, that I can learn how to fix them, and I will always have flaws, but I can learn how to improve on what I do know that I have flaws. And then also, so I can realize when I have made a mistake and remember that I am capable of making mistakes. I might have an opinion that in an argument that I realize, oh shoot, no, that's not right. But I can either choose to be a stubborn brat and keep arguing it, or I can just be like, okay, I messed up. And I think just taking credit for your mistakes as well as your accomplishments are very important. And I think that applies for all kinds of relationships, especially when you're talking to a patient and you realize, oh shoot, I messed up. Own up to it, acknowledge that you're not perfect, and I think that helps a lot too. And going along with that, all these lessons kind of go along with each other, is to have realistic expectations from another person. So I know a friend who is absolutely the best. She does everything for a friend. She's amazing. But I think it's just hard because not everyone is going to be as sweet, and you have to have those realistic expectations that not everyone is going to go get you a cupcake at 4 a.m. when you're upset. You might want it, but it's not a realistic expectation to have. And I think when we set the bar so high for someone, it can lead to a lot of disappointment. So I think having a bar at a reasonable level, like, okay, if I'm sick, I do expect you to kind of, help me a little bit or acknowledge that I'm sick, rather than maybe I'll expect someone to take care of me 24/7 when I'm sick. That's not realistic. It's gonna lead to arguments. So have a realistic expectation depending on what you know of the person and just common sense. But that can kind of suck for my friend who's absolutely amazing, because I don't think she can expect as many people to be as amazing as she is. So it kind of sucks when you have to lower the bar for others compared to what you would do for them. And I think that's just a part of life, and I think it makes things easier to just have a realistic expectation from others. And then this advice, I think I mentioned in the empathy video, is to try and put yourself in the shoes of another person, the most generic advice. But I think it's really important to put yourself in the shoes of the person as that person. I will react a different way to a certain situation than another person will. And I might say, okay, well, if I was in that situation, I would act like this. Why are they acting like that? Okay, no. I have to realize this person has these certain traits. This is how they're going to react. Okay, maybe they're a little more scared. So I tell, like, let's say I tell a person that they have a certain, like, okay, for me, when I was told I was going to have a surgery for my ACL, some people, whatever, it doesn't matter. But for me, I actually cried when I found out that I was going to have an ACL surgery because I was relatively young. I was afraid of the word surgery, and I was so distraught that, oh my God, like someone's going to cut my knee open. And I think that it's important for your friends, for your patients to remember they are not you, and they have their own fears that they have to deal with. And you have to acknowledge that. So that doctor should go into my shoes and be like, okay, this is a little 13-year-old girl. She's going to have surgery. She loves sports. I'm telling her now, I'm going to cut her knee open. She's not going to be able to play sports for a while. I have to understand what she's going through. And you also have to convey that you understand what they're going through. And also acknowledge you might not fully understand what they're going through, but try and understand, and also make it clear that you're trying and that they're valid. You have to validate how a person's feeling. Don't make them feel like their feelings are irrational. Maybe they are. And I think depending on, for patients, you have to quell that fear. With other people, you can call them out. I mean, I know I call people out for being irrational sometimes, and it's okay. I want people to tell me when I'm being irrational. But with patients, you have to just think about what they're going through. Okay, I would be irrational in this situation too, or maybe I wouldn't be irrational in this situation, but I could understand someone else being irrational. And you don't always have to exactly understand what that person's going through because you're not them, but you have to do your best to try and understand. And you have to make it clear to them that you are trying. And then, so that applies to I think any relationship, and I think that's a big one, is to try and understand what a person's going through, because that can help you react, and it can also help make the other person feel understood. And then the last thing that I really think helps is doing the little things. With patients, remembering their little kids' names, remembering their birthday, even if you have to write it down on a note, and when you see the person, just refresh yourself, because I have a bad memory. Great, I'm in med school, bad memory, that's great. But just take the notes, remember, and then bring it up with the person so that they feel like you care. And also genuinely care. Don't just make it be a facade. Actually care about the person. With friends, sending little cards, making them a little treat when they're sick. I think that those little things matter a lot. And then with significant others, do the cute little things, surprise them. Just make sure that the person knows that you care, and the little things that make them understand that you really do care about them and that you're thinking of them, and you're making an effort